This is a lecture on blood vessel pathology. We're going to be covering a little bit about some of the pathologic changes that occur in blood vessels, and then talking a little bit about some congenital blood vessel anomalies, and then we're going to talk a little bit about vasculitis with Anca, P-Anca, C-Anca, that kind of stuff. So to start off with, blood vessel pathology. These pathologic changes, when there is a pathologic change in a blood vessel, typically what's going to happen is it's going to be that blood vessel narrowing and or obstructing. In other words, when there is some kind of trauma or problem that's going to lead to disease, it's because this blood vessel is narrowing and obstructing, usually. Either that, or it's becoming weaker, the wall's getting weaker, and it's going to have either, well, a couple of different. I'll get to that in a second. So first of all, when there is a pathologic change in a blood vessel, it can be a quick change or it can be a slow change. If it's a quick change, it's going to be from an embolus or a thrombus, which is to say there is a big blood clot that has formed either on that location originally or has formed somewhere else and has gone to this area and now gotten stuck there. So that's a quick one. So if it's a slow one, though, it's going to be from atherosclerosis, which is where you get an atherosclerotic plaque on the inside of the blood vessel, and that atherosclerotic plaque ends up bulging out like this, fills full of these macrophage called foam cells that have eaten a bunch of, anyway, not too important. But anyway, point is that's quickly versus slowly. So the other thing that can happen here with pathologic changes in blood vessels is you can have the weakening of the wall. So, each blood vessel has, these different layers to it, and in the wall of this blood vessel, you can have a dilation, which is where when something gets dilated, it gets bigger, right? So in the case of a dilation, you can see an aneurysm. So here would be like a normal blood vessel, but if something happens where this wall gets weakened, this can kind of bulge out like that, and you can form an aneurysm. There are some cases where it can rupture, so this would just basically pop open, and then you have blood all over the place. And also there can be a dissection. So if you remember, there are these three layers to a blood vessel, like this. It's essentially where one of these inner layers has ruptured, the stronger one, and so the blood ends up filling up, kind of separating, almost dissecting the two layers together. So you have like a layer like this, and you have all this blood like in here, kind of dissecting some of these layers of the blood vessel apart. So now moving on to some of the congenital blood vessel pathology. You can have Barry aneurysms, that's typically the one that occurs in your brain, or an AV fistula. Now, both a Barry aneurysm and an AV fistula can lead to, again, cerebral hemorrhage. So with an AV fistula, though, it can be either congenital, which means something that you are born with from a genetic problem or something like that, or maybe something during childbirth, or it can be a second degree, which I believe means it occurred afterwards. It's one of these AV fistulas is basically, I think A stands for artery and V stands for vein, and so typically you have like an artery like this, and then you've got your vein over here, and between connecting these two, you're going to have capillaries and all these things like that, kind of connecting them together, and the blood will go through here and it'll go from here to there. And that's good because then it can oxygenate all the surrounding tissue. But in the case of an AV fistula, essentially what happens is that you get this like a shunt, basically. It bypasses the capillaries and those vessels and just sends the blood right over from the artery to the vein. Next, fibromuscular dysplasia. So when you think fibromuscular, it means it's in the blood vessel. There's going to be a layer that is the muscular layer, and there's also, more fibrous layers depending on the blood vessel. But essentially, this occurs in medium and large muscular arteries, and it involves a focal, which means a certain area, irregular thickening. So if you've got a blood vessel like this, a certain spot on here is going to get this irregular thickening. And in young women, this is one of the main causes of renal vascular hypertension, apparently. Now moving on. I know it's difficult to see this, but I'll explain what I'm talking about. This is for me, really. So next, vasculitis. Vasculitis just means that your vasculature is inflamed. And it can be inflamed for a couple of different reasons. So it can be inflamed. Well, I won't go into the reasons, but anyway. So if it gets inflamed, it can either weaken it, so that it would lead to dilation, that sort of thing like that, or it can the inflammation on the inside can kind of get so inflamed here that it kind of takes up all the space, so it kind of narrows it. So if the inflammation weakens it, so that it's all kind of inflamed, weakened, all the tissues are kind of separated out, so it's not as strong, then it may stretch, and if it stretches, it can cause an aneurysm, which is again that little bulge you see, and it can lead to a rupture. But if it gets inflamed and it narrows and closes, so it gets so inflamed that it just fills up all the space and maybe closes entirely, then all the tissue that blood vessel is normally supplying is going to become ischemic, and that's going to lead to tissue damage. So there are also two different kinds of vasculitis. There's one kind of vasculitis which is localized. Okay, if it's localized, it's going to be due to either trauma. So if I were to just damage this tissue here, then these blood vessels would become inflamed. Or it can be from infection. Like if I had a localized infection right here, that the blood vessels right there can be inflamed. Or like if I had a zit, that would be a location of a localized infection. Sometimes it can also be caused by a toxin. So let's say, I don't know, for example, think of me like a bee sting. So in that area where there's a bee sting, it's not infected with anything. Yeah, a little bit of trauma, but not enough to really merit this huge response. But the toxin is causing a lot of inflammation in the area. So it was localized vasculitis, but there's also systemic vasculitis. Both of these are second degree, which means this isn't vasculitis from birth, I'm assuming. So the systemic second degree vasculitis is of some kind of immune origin. Remember, the other one was trauma, toxins, or infections. This one is immune related, so your immune system going throughout your entire body. And it's going to be some kind of antigen-antibody complex. Remember, you've got your antibodies like this, and then there's some antigen. And this complex here is the culprit. There are three different kinds worth of mention. There is serum, or excuse me, I'll just word it this way. So this is what we wrote down. Serum is to cytoplasm, so I guess the blood, and at least there's cytoplasmic antigens in the neutrophils. So some kind of, I guess, interaction between the cytoplasmic antigens in the neutrophils and the serum, I guess. There's a word here that we need to get familiar with called Anca. Anca stands for anti-neutrophilic cytoplasmic autoantibodies. So I'll write it out so we can kind of see. I guess I'll just do the whole thing here. So auto is the A. Excuse me, not auto. Anti is the A. Neutrophilic is the N. Cytoplasmic is the C. And autoantibodies is the A. That's the ANCA right there. If you can see that. Can't even see what I wrote, can you? There it is. Yeah, you can't see it. Okay, good. So that's ANCA. So try to remember that. Anti-neutrophilic cytoplasmic autoantibodies. So there's P-ANCA and there's C-ANCA. Basically what this is to say is P-ANCA, they call it P for perinuclear and C for cytoplasmic. So kind of drawing this out here, if let's say this here is a cell, okay? So P-ANCA would be peri, so out here, so it'd be something going on out here, whereas C-ANCA would be cytoplasmic, in the cytoplasm. So there's two kinds of ANCA, anti-neutrophilic cytoplasmic autoantibodies. So there's the perinuclear, which I guess has to do with anti-myeloperoxide, And then there's also Anca, which is a cytoplasmic, which has to do with anti-proteinase 3. So yeah, it's kind of hard to remember, but maybe a way to get this down is you can think. Oh, sorry. One other thing too is the Anca is associated with MPO. Now I don't know what these things mean, and it doesn't explain on the PowerPoint. I apologize, but I'll just go through it again. Anca, also he has in parentheses MPO Anca, is the perinuclear. So perinuclear, and apparently that has something to do with anti-myeloperoxidase. So maybe the P for the peroxidase, I remember that. And then there's Anca, and that is cytoplasmic, and he also has the letters, or this PR3. I'm not sure what PR3 stands for, but he has it on there. And anti-proteinase 3. Maybe I guess maybe that's what that stands for. Yeah, anti-protein. I don't know. So the C one here is the one that's to do with protein.